is the Emergency Medical Minute.
Okay, so I meant to do this one a few weeks ago and I forgot about it, but it relates a little bit to more of the flu season. And we all know kind of the limitations of Tamiflu, but there's several new drugs that they're looking at for treatment of influenza. And recently in Japan, their health ministry approved a drug that I had to write down called baloxavir marboxil that goes by the trade name of Xofluza with an X. But it reportedly can kill flu A and B in less than 24 hours in as little as a day. And basically the way it works, it's a kind of a newer, what they call a cap-dependent endonuclease inhibitor that suppresses viral replication by a different way than all our typical flu and antiviral medications. It can kill the flu virus in 24 hours, although symptoms may last a little longer than that. And it actually comes in a single dose, so it's a compliance issue. You could give it in the ED once, or you could send somebody home with single dose. It's actually pretty easy to give. They performed a randomized double-blind trial with about 1,500 patients, so a good amount of patients that were positive for the flu, and they found significant improvement in the median time to improvement of flu symptoms over placebo. So 53 hours with the medication versus 80-something hours without the medication. So that's actually better than Tamiflu. They found the fever resolution with flu to be markedly improved as well. So 24 hours with the medication and 42 hours with placebo, so a significant improvement. And then they noticed some improvements in what they called significant important key virologic endpoints. So if you tested patients for if they were still flu positive at 1 day, 2 days, 4 days, it was better than Tamiflu at all those things. And then they looked at viral shedding, people who are still shedding the virus, and it was markedly better. So theoretically it would make you a lot less contagious, a lot quicker. So definitely didn't really talk about side effects for it. FDA in America hasn't approved it, and it's not even up for approval until 2019. So just something interesting that I read that I meant to bring up into flu season, but still had it.
Thank you. All right, guys. Have a good day.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.